So thanks for joining me on this discussion of rheumatoid arthritis and how a functional medicine approach can ease your sore, achy joints. I'm Mary Scalf, and I'm a physician assistant here. So I started my career in rheumatology, and I'm so glad I did. I'm so passionate about treating patients with rheumatic conditions. But rheumatology taught me a lot, and it left a lot to be desired. Because what I would find, and specifically with all my patients, I treated a lot of different rheumatic conditions, but in rheumatoid arthritis, it's like I saw that I had patients that just struggle. They struggle to get their disease under control, and they might have been on multiple medications to control their condition. And these are medications that, talk about in a little bit, just have side effects that can compound and put them more at risk for certain things. And so it just didn't make sense to me. It's like, shouldn't this patient be living their best life if their inflammation is down, that their pain is down, but they still have this fatigue and they still kind of achy and stiff and sore. On the other hand, I had some patients that I could see less frequently with follow-up safely. Instead of every 3 months, I could see them every 4 to 6, and they only needed one drug to control their RA or manage it per se. And if I think about those patients, I think about how they used nutrition and dietary changes and also exercise to help change the way their disease presented. So, and then as I reflected what I did for my own health and my own challenges, I got a lot better with changing my diet, moving to a paleo diet, and beginning consistent exercise and enjoying a hobby, namely CrossFit and mountain biking. So it just didn't make sense to me. And then I learned about functional medicine, and I was really excited. I remember seeing a rheumatology journal on the desk of the doctor I worked with, and that there's an article about how there's a couple bacteria in the gut that were associated with the development of systemic lupus. And I had started mentioning this to him before, trying to get him over to this side of things. And I felt like I was this crazy person. Like this, like, look, see this, we can do other things for patients. Like, because he originally told me that nobody wants to exercise or change their diet. Well, that's why you come to us, because you're willing to, and you see the amazing changes that can happen for it. So I want to just go through the basics of rheumatoid arthritis. So what is it? So it is a progressive, destructive, chronic autoimmune inflammatory disorder. It primarily affects the smaller joints, namely the hands, the feet, the wrist, and the ankles. It also can affect the knees, the elbows, the shoulders as well, and sometimes the hips. Rarely ever the spine, though. There is no cure for it, unfortunately. RA and autoimmune diseases are alarmingly more common than we want to think. And the annual incidence of it in our country and Northern Europe is about 40 every 100,000 persons. That's a lot. And the have RA is more than just uncomfortable joints. You can be out of work. You won't be able to enjoy some of the things you once did before, and thus gets to reduce quality of life because you can't do your job and swing a hammer. You can't ride a bike or grip. Your grip strength has decreased. You can't get on the floor with your grandkids or your kids. You also got an increased risk of other chronic diseases, namely heart disease and other vascular diseases and issues with lungs. You're at a higher likelihood to get joint replacements or joint fusion surgeries. And it's just, RA is just a really expensive disease to have, between office visits, physical therapy appointments, occupational therapy appointments. labs, medications. So what's going to put you at risk for RA if you don't already have it? So if your mom or dad or brother has RA, you are at a threefold increase for having it. If grandmother, uncle, aunt, somebody like that had it, you're at a twofold increase of having it. Typically, this is going to happen in middle to older age. However, the patients that I have treated for this are all younger than that at our clinic. You're going to see this twice as much in females than males. And then also there's association with lower socioeconomic and educational status. Smoking. If you are smoking and you have RA or you have any kind of joint pain, or even if you're at our clinic in general, we need to stop because it's just going to create inflammation. And smoking is the strongest known lifestyle factor for RA. So you have joint pain, but how do you know if this is inflammatory or not? We have so many different types of arthritis, and it kind of comes down to inflammatory and autoimmune. There's inflammatory and not autoimmune, and then you have this mechanical wear and tear and degenerative arthritis. So you're going to have pain, swelling, warmth, or redness in joints on both sides of the body. If you have it in your fingers, you're going to have it on your right hand, you're going to have it in your left hand. If you have it in your left wrist, you're going to have it in your right hand, and so on and so forth. However, it may not always look the same, and that would be a picture perfect world. But if you have pain in the right hand, you'll have pain in the left, it may not be the same finger. You're going to have effect of these joints. That's where RA likes to affect. And here, RA never attacks these. These are called DIP joints. When you wake up in the morning when you have RA, you feel like a tin man. It's difficult to walk. You feel like you're much older than you should be. And that stiffness will last around 60 minutes before you loosen up and really feel like you can move for the day. We may all feel stiff in the morning to a degree, but it usually is not going to last that long. The pain and stiffness is going to improve with movement and warmth. So if you get in a hot shower, you're going to feel much better. You're going to put your hands in warm water. Your hands are going to loosen up. And if you're sitting still or sedentary, you're going to get worse again. Usually with a mechanical arthritis, activity is going to make it worse and rest is going to make it better. You also can have systemic symptoms like fatigue and loss of appetite and maybe even fever. So treatment with RA has come a long way. Because at one point, to have a diagnosis of rheumatoid arthritis, you're probably were going to end up in a wheelchair. And that's just not the case as much these days. Are people completely cured and healed and not having joint damage? No, that's not happening either. So usually, before people come to see a rheumatologist, or they try to manage their pain with NSAIDs. NSAIDs, those are going to be your ibuprofen, your naproxen, meloxicam, diclofenac, and the like. And so all of these medications work to block a specific signal in that immune cascade or the pain cascade. And so the downside of the use of things like ibuprofen is that chronic use of those are going to put you at risk for ulcers and bleeding. I see changes not only to the liver function, but kidney function with individuals. Especially when we think about what we do in functional medicine, this is just going to cause gastrointestinal inflammation, and it's going to increase intestinal permeability or that leaky gut, particularly with ibuprofen. There's other side effects for NSAIDs too. I just saw this more commonly. Steroids are going to be like your prednisone, your meteral dose pack, and usually everybody feels good with a steroid. I had some people just felt crazy on it. They're not really good to take at night. They can really disrupt your sleep. You may notice weight gain in it because you get this insane appetite. You just want to kind of eat everything. Not everybody does, but some do. You might have swelling and retain fluid. Your blood pressure may increase. If you're on steroids chronically, you're going to see an increase in osteoporosis, which having rheumatoid arthritis, you're already at an increased risk. You're also going to have increased risk for infection, and you're going to have delayed wound healing. So it's hard to get well when you're on a steroid, yet it helps to decrease your pain and your symptoms. It kind of doesn't make sense, does it? The game changers and treatment of rheumatoid arthritis came with the introduction of DMARDs, and that stands for disease-modifying antirheumatic drugs. So a lot of these drugs, some of them are actually chemotherapeutic, like methotrexate, and that's one of the mainstays in therapy in rheumatoid arthritis. It's usually taken once a week. Many of these drugs, like hydroxychloroquine or Plaquenil, leflunomide, sulfasalazine, azathioprine, we can see white blood cell changes, increases in the liver function. So you think about this as toxic to the bone marrow and to the liver. People are usually noted, especially with methotrexate, fatigue, or just overall not feeling well the day after they take it. So it kind of ruined their Saturday if they took it on a Friday. You get nausea, vomiting, hair loss. It's also going to increase your risk for infections. Also, methotrexate is really interesting. I just want to point out, when you are prescribed methotrexate, you are given folic acid to take 1 milligram every day because of the way that methotrexate is going to inhibit or kind of use up that folate that your body needs. What's interesting though is that not everyone is set up well to be able to use that folic acid. It's not bioavailable to them. It's not the usable form. Your body has to do another step with methylation to make it into methylfolate, which is going to be the acceptable form to your body. So one of the things we like to track here to look at that for like nutrient deficiencies is called your MCV. It tells us about the size of your red blood cell. And if that size is greater than 92, then we'll think of that lack of B vitamins or that need for B vitamins. And so if you have lack of B vitamins, that may play into some of the fatigue. There's a lot more concerns with DMARDs than I listed here. And then kind of lastly, the game changers that have come along probably in the last 15 or 20 years are your biologics. And these things are some of the #1 selling drugs on the market. These are like Humira, Enbrel, Actemra, Rituxan, Remicade. All of these are Xeljanz, Alimia. All of these are going to end up usually in MAB or AB. These are really good drugs, and I really saw this turn around a lot of people. Like they went from really hurting to a lot of improvement and quality of life, but only for so long, because eventually they ran into getting an infection. It may not have been a serious infection that needed hospitalization, but we had to stop therapy and initiate antibiotic treatment when they got sick, so they didn't get a serious infection. These medications also may increase risk for malignancies. So thankfully, I didn't see any of those serious side effects, so I'd hope to say that this is less likely. However, the things I did see were those mild infections that happened, the need to come off. When you come off the medications, you will usually flare, and then you would fight to get the disease under control again. It was a very like touch and go kind of thing. But I still like, through all of this, I just thought, because RA is so aggressive in some people, that if we didn't have to be on one of all of these medications to improve quality of life, to reduce pain, to improve function, then I thought that would be a win. And so my aim and what we do here is to try to reduce the amount of medications that you need to fight this disease, or reduce the doses of these, or how frequently you need them. So I was listening to a internal medicine podcast the other day, and it was about rheumatoid arthritis for the primary care physician. And this rheumatologist was saying how he explains to patients how rheumatoid arthritis is your immune system turned on or it's attacking itself. And he talks about, when he was asked about if dietary modifications or other kind of supplementation helps to reduce these symptoms, he said it was all kind of pop science. And then the next breath, he literally said, I don't know what turns on your immune system to cause this. And and honestly, that is what we do in this clinic. Like, we are working to find out what turned on your immune system and kind of what pissed it off. So I'm very thankful for conventional treatment. When it's necessary and needed, then there's no shame in using it. But I just still believe there's also a better way to do things. But we want you to have a good quality of life. We don't want the disease to progress. So sometimes it's a both and not either or in what we do. So I don't want you to hear them saying these medications are evil. And so now let's get to functional medicine. This is how we do it. Hope you remember that song. So, what is the root cause of nearly all, if not all, chronic disease? I'll give you a hint. Inflammation. Inflammation in acute processes is necessary. Chronic inflammation is another thing altogether. Chronic inflammation is going to be linked to several things: dementia, cardiovascular disease, diabetes, cancer, even depression, certain neurological conditions, autoimmune conditions, arthritis. So we want to see kind of where you stand with inflammation, and we want to work to bring that down. And that's some of why some of us, maybe namely me, are kind of incessant about checking either inflammatory markers, because I want to see that what we're doing is working. I really care most that your symptoms are getting better and you're noticing changes and improvement in your life, but I want to make sure we're on the right track. So we work to go as far upstream as possible to find out what triggers started this in the first place, and what is keeping this inflammation going. And if we address these things, we change them, we can help support and change and modulate these mediators with nutrition changes, with lifestyle factors. And so by decreasing inflammation, we support your immune system. And rheumatoid arthritis is an immune problem. And so by supporting the immune system, we are supporting it becoming wiser and less reactive to self. I like to think of this as we're letting the dust settle as we do this work to really uncover what is underlying the underlying. So when we start to take off these things and uncover what we do, we may find what the different roots are to why this is. It's really important to work with whoever it is at your clinic, and if you're my patient, then of course with me. To answer these questions, to try to figure out what factors play into your RA and how this all started. For everyone here, the question, when were you last well, is probably one of the most important questions that we ask. Because if we can remember when we were last well, we know what it is like to feel well. If we can remember when we last well, then we can kind of put together what events what happened, the circumstances that surrounded this, that triggered this onset before you started to develop whatever it is, namely here, joint pain. And then we care about what happened in the past and what exposures you've had and how you grew up and your family history. These are things called antecedents that kind of set the scene, that maybe had this fire of inflammation smoldering before the disease actually kind of caught fire and really started going. And then there's things in our life that we do that keep things going and from getting better and maybe even getting worse. And those are those mediators. This is the functional medicine tree. And when we think about, when you come to see us, that we already have a diagnosis of a certain organ system. And maybe you fit into musculoskeletal, immunology, but we don't think of you as a diagnosis. We think of you as a whole person. And that whole person comes with so much more than a name of what is going on. You bring with you so much experience, bring with you so much knowledge, you bring so much longing, so much hope, and quite a few of you have a lot of deep hurts that contribute to what is going on. So we do look at all the leaves of the tree, but we want to look down at the bottom here where all the roots are. This is kind of where we want to start to try to peel away really what is going on here. Because if you don't sleep well, you don't set yourself up well for the next day. Sleep is actually adding to a restorative process that helps support your immune function and your resilience. You will find data and research that shows exercise and movement will help to decrease pain and improve fatigue. So there's a thing, we feel that when we hurt or we don't feel well, we don't move, we don't exercise, we fear it worsening that. But the truth is, with many things, that motivation doesn't always equal action. A lot of times motivation follows action. So we need to try to go with consistent movement and exercise that feels good and doesn't cause pain to really help to get better. Kind of as I said earlier, one of the issues with rheumatoid arthritis is when you're stiff and you're still, that's when things start to hurt. And it's when those inflammatory mediators just group all in the joint and hang out there. Nutrition and hydration. There are things here to consider about just deficiencies and what we might have. There are, in the standard American diet, it's highly inflammatory. With autoimmune conditions, you need to go gluten-free until proven otherwise. Gluten is one of the most inflammatory foods we consume in our diets. And it may not just be because of the proteins contained in that. Sometimes it's more because of how that grain is processed in our country and exposure to glyphosate. Hydration, it's true, if we don't have adequate hydration, our joints need that lubrication, and they use some of that from adequate hydration. So if you think of some of the joint synovium as like a sponge, we need to have proper hydration to help support that. It also can help maybe decrease inflammation a little bit. Stress and resilience, how we deal with stress is very, very important. And what I would see in practice in rheumatology is that people would flare in their disease after stressful events. It never failed. And really no one was spared. So kind of what goes on with stress and how you deal with it, you need to have a practice at hand, a mind-body practice, something mindful, something that has you just there in the moment, present where you are, something that helps trigger your parasympathetic nervous system to help decrease that fight or flight in your body, to help tell your body it's okay to heal, that we're not being attacked, and we have the chance and opportunity to just rest and to get better. In this process, if you do not have support from your family, it's really difficult to do the things we ask you to do here. And I'm just amazed at the people who are able to complete this, who don't have family support. So if you don't have it, I'm so sorry. But I'm amazed at how capable you are. If you do have it, that's an amazing blessing. And just express gratitude for that. There's a connection with underlying trauma and development of RA. There is. So you have to think about the things that we go through. We like to just stuff them back in the back of our minds and think we'll deal with them later, or that's just something that happened. It doesn't affect me now. Well, your brain never forgets. And what happens is, as the stressful situations happen and we lose resiliency and the day-to-day gets to us, this opens up for that trauma to come out and work its way out. And it works itself out, not in the symptoms you would think it would. It can work itself out in pain and fatigue, not necessarily just depression or anxiety. Microorganisms. So this is kind of goes either way. Our immune systems haven't been exposed to enough critters per se due to how hygienic we are in our country. But on the flip side, we have these organisms in our gut that help to improve our health if we feed our gut. When we feed our bodies, we're not just feeding ourselves, we're feeding this organism in our body known as your gut microbiome. So they will influence the formation of things to help support your immune system. Gut health is going to be very central to this process. Environmental pollutants, kind of what you are exposed to, is going to be very important. We mentioned smoking as a #1 risk factor, lifestyle-wise, to develop RA. So if you're a former smoker, I want you to ask your clinician about checking for heavy metals. And specifically, you may have a higher level of cadmium in your body. And that cadmium can be contained in your tissues, even if it's not in your blood. And so that cadmium may be triggering your immune system and causing your arthritis. We also might have other environmental pollutants, certain pesticides, microplastics. This can continue and go on. So I make sure you think through the question, if you haven't: when were you last well? Think about what happened then, and then what happened, and then what happened, and start to piece together kind of what it is that may have started this, and it'll help us kind of pinpoint where we need to do our investigations. So we already kind of went through these, but I'm going to mention a ton of specific things because, again, we are trying to make your immune system more resilient. We're trying to settle the dust and clear up all that is to decrease inflammation in your body, to reduce those inflammatory cytokines and that cascade. So allergens, I want you to think about, if you have allergies, it's important to get those under control. Think about if they're really bad, think about doing allergy drops at our clinic. That's going to be retraining your immune system to build tolerance to those environmental triggers of allergens. Also, think about food allergens. Things like I mentioned, gluten are kind of highly inflammatory and can perpetuate that leaky gut. Also, I see a correlation with dairy causing some of this pain too. So it's good to try and remove all these environmental or potential ingested allergens to try to calm things down. Toxins. I mentioned cadmium just a little bit ago, so think about that, and maybe other heavy metals you may have been exposed to. Maybe if you're an artist or if you worked in a factory, kind of let us know about that stuff. Mold-related illness may be a predisposing factor here. So if you have been in a moldy building, have black mold in your house, talk about this with your clinician, because we may need to dig down that pathway. Infections. So infections that may kind of start RA can be linked to infections in the gut, things like Citrobacter and Klebsiella. They have found such things at the cell walls and joint spaces, and sometimes when you have inflammation in the joint, they'll draw a fluid of it. They have found bacterial cell wall and there's bacteria in there. I found this in the stool in the gut of one of my RA patients the other day. So I'm thinking that's a predisposing factor here. And if we can get that gone, then he'll get better. Also think about if you've had a history of tick bites, if you've ever had a tick bite way back when and you develop fevers or rashes or joint pains with that. Tick-borne illnesses can cause RA. Also think about things like chlamydia or hepatitis. Those also can be predisposing factors for developing some RA-like symptoms, but they usually are transient and go away. But still would be good to know about to investigate, make sure this is not underlying. There's other infections we can look into as well. Nutritional deficiencies. We like to see what your body is asking for and what it needs. There's specific nutrients, namely like vitamin D, that are going to support your immune system when at sufficient levels. Antioxidants, if they are low, that's going to be a problem in RA. I'll talk about that with oxidative stress. Omega-3 fatty acids. Omega-3 fatty acids, those help to decrease inflammation in the body. We really have too much omega-6s in our diets to begin with. And omega-3s are going to, again, help reduce that inflammation, help rebalance the omega-6s. Omega-6s are pro-inflammatory in our diet. So make sure you're eating fish or taking fish oil to help reduce inflammation. And dose here is really important. When you have RA, you need to take a really high dose of fish oil around the tune of like 3,000 milligrams twice a day. You also want to make sure that you eat a colorful plate. You want to eat the rainbow. I'm not talking about Skittles. So eat lots of colorful vegetables, fruits, healthy fats, nuts, seeds, spices, herbs. They all have something called phytochemicals, which can increase anti-inflammatory properties, or they all have anti-inflammatory properties to support health, and they help to increase antioxidant status. Kind of already mentioned trauma and stress. I'm not going to belabor that. I do want to mention oxidative stress, okay? So if you have a chronic inflammatory condition, and you do with rheumatoid arthritis, you have a certain level of oxidative stress. And what this is an imbalance of something called reactive oxygen species that your body makes and free radicals versus antioxidants. Antioxidants help your body to deal with those things and to get them out, but you accumulate these with rheumatoid arthritis. And this actually can just keep things going. And what would be good here, that for some reason we do have available at our clinic. So aside from increasing antioxidants in your diet or with supplementation, I want you to consider discussing this with your clinician about doing IV ozone. IV ozone actually creates a short oxidative stress, which actually creates the body, which causes the body to create antioxidants to help combat oxidative stress. IV ozone is really good to decrease inflammation, to impact total viral loads, or to decrease bacterial infections. It's anti-inflammatory. That's a lot of good things, and I'm actually going to talk to some of my patients about that. We recently we acquired a hyperbaric oxygen therapy chamber. And so hyperbaric oxygen actually has some very good data to help improve pain and fatigue in RA. And there was a blog that went out about this, and I'll let you kind of read about it there. But talk to your clinician about doing these if you're interested, because if you've already done kind of all this work or looked into these pathways, then that might be a road to go down. I want you to know you are not powerless to your rheumatoid arthritis. None of you are powerless to the symptoms or disease you deal with. You're not just at the mercy of medications and their side effects. You do have the power to change the trajectory of what is going on. You must believe that you can. I just want to thank you for joining me. Rheumatoid arthritis and rheumatic conditions are something I'm very passionate about. And I love working with all my patients, but they have a special place in my heart because I walked with so many patients in this condition, and I didn't have the tools. I wanted to help them more than I could. And I felt like I was running short with those patients, coming up short, and I want to do more for them. And then here I can do more for patients. So if you have any questions, let me know. Otherwise, I've very much enjoyed talking about this with you all. And if you have any questions to follow up later, if you follow us on Instagram, potentially put a message into our private messages and let me know. I'd be happy to hop on and answer questions on our Instagram or other social media platforms. So great. Well, thank you so much. And until next time, thanks for joining us.